Hello and welcome. My name is Cheryl Boyer, and of course this webinar just started and my camera is not working properly. I apologize. My name is Cheryl Boyer. I am at Kansas State University and I'm the extension lead on this project, which is about lessons from COVID-19, consumers' interactions with the food supply chain. So this is a multifaceted project, and today we're going to cover in large part the data from the consumer behavior survey that was conducted earlier this year. So it's a fast-moving project and we have lots of pieces. Before we get started, there are some controls that you can use in this Zoom webinar. So if you would like closed captioning, that feature has been enabled. So click the double C button on the bottom of the screen and you should be able to have access to see what everybody is saying. If you can't, let me know in the chat and I'll see if I can toggle some settings. So our team is wide ranging. So we're all across the country. We've got 5 universities and 2 centers are involved in this project: the University of Minnesota, the University of Florida, myself at Kansas State University, the University of Wisconsin at Madison, and the University of California at Irvine. So this green symbol you see here is the Center for Public Issues Education at the University of Florida. And this symbol is the Center for Rural Enterprise Engagement, which encompasses 3 of us at the University of Minnesota, University of Florida, and Kansas State University. So lots of us, we've expanded our team and it's been a really good experience. So our project is called Lessons from COVID-19, Positioning Regional Food Supply Chains for Future Pandemic, Natural Disasters, and Human-made Crises. It's one of 17 projects that were funded by USDA, NIFA, AFRI, Rapid Response to COVID-19. So this was very early in the pandemic process and we started the project last September. So we've been going for a little over a year and have accomplished a lot. So if you would like to view the previous webinars, we have a 4 webinar series. The first 2 already happened earlier this year and they're archived on our website, which we'll put in the chat here in just a little bit. So you can watch the recorded versions of those. And once this presentation is recorded, it will be available there. And I will also email everyone who has signed up to receive program updates. So we just want you to know that while we're happy and to be able to share the results of our project with all of you, we also need your contributions. We're all living through this experience together of the pandemic, and we can all learn from each other and grow and improve and try to make it better for the next time and for the future. So we really appreciate your contributions to our project. For today, this is our 3rd webinar. I'm going to give you just a brief overview. If you want to know a little bit more, that's covered in the previous webinars and on the website. So if you want a little bit more information, you can find it there. And then we'll spend quite a bit of time on the consumer behavior survey, and Laurie Baker and Hikaru Peterson are going to cover the data from that project, and just a few minutes for brief updates on the other components of the project, which I'll tell you about in just a minute, from Krista Court, Michelle Miller, and Hikaru again. And then we will close and take some questions if we have time. So first, our project overview. This is, you guys are all aware, we're even more today, it seems like, that COVID-19 has disrupted our supply chains and has really affected our agri-food system. So this project involves research, extension, there's some teaching involved with all sorts of different disciplines to try to address these problems through transdisciplinary work. So we want to generate knowledge and resources to enhance the preparedness of our U.S. agri-food supply chains for future disruptions. We will explore the extent to which regional food systems can effectively augment mainstream supply chains to meet the nation's food needs, with a focus on ensuring the economic security of our small-scale operations. So we have been building data and resources on that topic to that point. So overall, we're really seeking to assess the impact of COVID-19, the pandemic, on farm and food supply chain operations. We want to understand the capacities and structural vulnerabilities of regional food systems to support their population needs, develop resources and strategies for current and future disruptions, and develop and offer training programs to strengthen and support our understanding for local and regional food supply chain participants when we have times of disruptions. And those can come at any time, and include more than just a pandemic. So we want to create resources that will last, that will be there the next time they are needed. So again, I mentioned our project team is at lots of different institutions spread all across the United States. And here are some of our, well, these are most of our faces. We do have some grad students on the team that join us, and their faces may not be here, but you can see that we have a group that is in Southern Florida. We have another, and these were also our 3 project study areas as well. And so we're spread out all across the country, and those also encompass the project areas that we studied. And I'm right here in the middle in Kansas. We want to thank our advisory committee. We really took a lot of care to invite people across the supply chain that could really inform and impact our project and help it be more relevant. And those include Ben Nauman with the National Cooperative Grocers, Christine Tran with the Los Angeles Food Policy Council, Christopher Bacon at Santa Clara University, Helene Murray with the Minnesota Institute for Sustainable Agriculture, John Walt Boatwright with the Florida Farm Bureau Federation, John Silanoff with Minnesota Regional Transportation, Keith Harris at Kansas State University, Lauren Gwynn with Oregon State University, Robin Safley with Feeding Florida, Stephen Helfand, University of California, Riverside, Tori Ruminek, Florida Fruit and Vegetable Association, Tracy Irani with the University of Florida, and Xiaohui Wu with Oregon State University. And just as a brief overview, these are some of the activities that we have. The very first thing we did was a COVID-19 impact survey on farmers and supply chain businesses and workers, and that we have covered in previous webinars, so you can get that information on the website. This time, we're going to spend quite a bit of time talking about the behavioral change survey with consumers. We also have projects on equilibrium displacement modeling, regional food shed analysis, food flow and network analysis, and brainstorming some solutions with focus groups. So, and overall, we've got a communications platform, lots of deliverables. We're trying to share what we've learned in this project with others, and we have opportunities for professional development that we will share a little bit more about with you at the end. So with that, let's get to the meat and potatoes of this. I'm going to hand the reins over to my colleague Laurie Baker at the University of Florida to talk about the consumer survey.
Thank you, Cheryl. Let's start a little bit about what we did, kind of our methods in sampling related to this. We wanted to understand consumers' behavior change related to food purchasing. We used a platform called Qualtrics, and they collected the sample for us. We conducted the study basically this summer from July to August of 2021. It was a non-probability opt-in sample. We sampled specifically for US residents that were 18 years of age or older. And it was a stratified sampling method, making sure that we matched the structure of the US Census related to income, related to race, related to region. And we had a total of 1,004 responses in our final sample. You'll notice we didn't stratify for gender specifically because we did have some qualifying questions early on related to how much of the food purchasing they did for their household. And they had to have at least some portion of food purchasing that they did themselves in order to be able to answer our question. So as we know, sometimes gender does make a difference in who's doing the purchasing for the household. The survey structure, we looked at food purchases and acquisitions during 3 different time periods, and I'll go into some details of that piece. And we also embedded a choice experiment to really see how people would respond in a hypothetical health crisis. So with that, we can go to the next slide. These were our 3 timeframes, and I think this is kind of fun. My degrees are all in agricultural communication, but within this project, we're working with people who have degrees in sociology and who have degrees in economics. And so I feel like we really blended our skill sets nicely in all of the project pieces. But this survey, I think, really demonstrates that. We have some wonderful staff who helped us create these graphics. So as we were asking people questions about a certain time frame, we wanted to put them back in that mindset of what was happening during that time frame. So we have these graphics, and these are the 3 time periods we ask about specifically. There was the early pandemic, which we defined as March to April 2020. And you can see the highlights on that graphic of what was happening right then. We were masking, we were talking about flattening the curve, shelves were empty, places were closed. And then we asked questions about their purchasing behaviors mid-pandemic, which we defined as August to September 2020. And as you can see here, people were doing carry out. We were going to stores, but we were talking about social distancing. We were wearing masks. We were doing at-home schooling scenarios there. And then we asked them about current. It was current at the time of the survey for June 2021. And as you know, vaccines were becoming readily available. We were starting to be able to interact more and more with people. Some people were returning to school in person. There you see with masks. So I'll remind you along the way which timeframes we were talking about. But those are the graphics we had for the survey. So our initial questions were related to the changes they saw in their budget related to dollars spent on food. And we broke this down by particular categories. We based all of these categories on previous research and tried to come up with a frame that would match other people's work, but also gather the data that we needed. So in this time frame, we asked them first to compare the change in dollars spent by food category pre-pandemic with this time 1 category, which we were calling early pandemic. So the results of this piece, you can kind of see in this graphic here. These are the changes in dollars spent by category pre-pandemic to that time 1. And you'll notice on the far left, the light blue, those are the people that spent less in those categories. In the middle, the darker blue are the people that spent about the same. That light green category are the people that spent more, and the yellow category are those people who didn't buy anything in that category. So just some highlights as we're looking at this slide. You can kind of see for all categories that the majority of people spent about the same during these time periods, but there were some changes. People were spending more. That was the next highest category for almost all of these areas. I feel like this is always so interesting because these do not necessarily reflect my personal experiences of our food purchasing during the pandemic, but that's why we ask these questions, right? Is so that we can quantify how everyone was experiencing during these time frames. So people were buying more in some categories, but the majority of the people there in the middle, their spending stayed about the same. So now let's look at that next category time frame where we were looking from early pandemic, which was that March, April 2020 to mid-pandemic. And we were clarifying between those categories what their change of expenditures were. So let's take a look at those results. And you can kind of see a similar trend here. Fascinatingly, this one matched my situation a little bit more, as more people were purchasing in the beer, wine, and alcoholic beverages category. Quite a few people were also not purchasing in that category. One thing of interest to our team was certainly those fresh fruits and vegetables. We have an interest in finding out about those farmers markets and those CSAs. And you can see that there were a percentage of people there in the green that were spending more on those categories. So there were possibly more people. And when we talk about logistics and outlets, we can see that as well. Then next, we ask people to compare between that mid-pandemic, that August to September 2020, to the current time, which again was toward the end of the summer for them. So looking at those same categories, again, we're seeing similar trends. Things have started to stabilize in the pantry and dry goods and the dairy and dairy substitutes. We're seeing those categories that more people spending remained the same. Same with condiments and dressings. They weren't going crazy on those types of things, but we were seeing people again spending more in both frozen fruits, vegetables, and meats, again, perhaps tracking with as prices were going up, and the same again with fresh fruits and vegetables. So similar trends along the way there as well. Then the next piece that we asked people about is we wanted to know about their food outlets and logistics. How were they applying their food and how did that change throughout the pandemic? So I've highlighted a few of these here. We ask about these for a lot of different types. So we just pulled out a few of the ones that we thought might be interesting to visit about today. So super centers or supermarkets, tends to be the more traditional market. So we wanted to highlight that. For all of these categories, we ask them if they purchased during these different time periods, if they did that through phone ordering for home delivery, online ordering for bundled home delivery like DoorDash or Instacart, online ordering for at-home delivery, phone ordering for in-store curbside pickup, online ordering for in-store or curbside pickup, and in-store purchases for eating in. And then of course there was a not used category for that one as well. And you can see the different bars there are the time periods that I talked about before. So that light blue is that time one, that early pandemic, and the darker blue is that time two, mid-pandemic. And that time three is that lighter green color, which was what we were calling later in the pandemic, which was around summer. Then on all of these questions, we also asked them to forecast in the future. When we were asking it this summer, it felt very far away that we were asking them what they might do in the year 2022. Right now, it feels like we're already in 2022, but to kind of give us a picture of what they planned to do in the future related to supermarket purchasing. So I do find it interesting that in time three and in 2022, they saw themselves doing in-store purchases and eating in more and more. I was also kind of surprised from my personal perspective that so many people continued those activities in time one and time two as well. But we did see some increases in phone ordering and online ordering for people during those timeframes. But the majority of the people were sticking in their normal in-store purchasing habits. So let's take a look at some of the other outlets. Health, natural, or smaller format grocery stores. The same pattern. I won't read all the options to you on this one. I will just highlight a few. The largest number of people here you can see did not use these types, but we had similar trends in that in 2022 and in that time three, they were heading back to do more of those activities, and online ordering and phone ordering were up during those time one and time two periods. So I think this reflects, those periods of shutdown and when people were not able to go to the grocery store or didn't feel comfortable going to these smaller format grocery stores. So let's take a look at some of our other outlets. We also ask about convenience store, corner stores, the smaller limited options to find out people's behaviors there. Again, the largest category, we're not using these, particularly in that time two category. They weren't as much, but time three, they were returning and forecasting that they would return in store more often in 2022. Interestingly, one of the reasons we wanted to ask about all these smaller formats was to see how much of the online ordering and phone ordering were available for these types. And people certainly were indicating that, particularly in those time ones and those time twos, they were doing some online ordering and some phone ordering and some of the other types of ordering there. And you'll also notice for 2022, we certainly have some people that are going to continue to use those phone ordering and online ordering options. So
Sorry, we have a quick question.
Oh, sure.
In the chat. So for in-store purchases / eat-in, does it mean at home or at restaurants?
Oh, yes. So this is for each of these category types. So if they were going to either go to the store and purchase or eat in the convenience store, the corner store, or the smaller store for this slide in particular. So for each slide, that's what it was for the grocery stores. It meant for the category type within this particular slide. Thanks for highlighting that for me, Cheryl. So independent grocery stores was another category that we looked at. Not as many people were using these, but more than we're using our convenience store, small store, corner stores. It appears that in this category throughout the pandemic, many people were still going in store to purchase things from an independent grocery store. And as our question there highlighted, or they were eating in, we lumped those two together. So some of these may not have had options for eat in, but maybe they were considering in-store purchases. Again, in this category, thinking about independent grocery stores and food co-ops, these categories also had online ordering and phone ordering. And not only were people taking advantage of those in time 1 and time 2, they were also doing that in time 3 when maybe they were a little more comfortable getting out. And we're forecasting that in 2022, they would continue using those services. Although our largest number here, we're planning on going back to the store in these cases here. Now, farmers markets, as I say, this is a piece that's kind of near and dear to our team's heart, looking at some of these regional food supply chains and how they were impacted. Of course, we want to compare that with the other pieces of the data too. The largest number of people here were not using farmers markets, which I think anecdotally we were hearing that things had increased in this area. And I think we can still say in this data that they did increase during these times. Maybe more people were using these outlets, even though the majority of people still weren't. But I think we all know that farmers markets probably aren't going to entirely replace our traditional supermarkets, but we did see an increase in some of these numbers. So people, it looks like, are planning in 2022 to head back to in-person for those farmers markets. But in time 1, there weren't as many people. Many people were choosing some of those at-home delivery options, those online ordering options, curbside pickup options that were available during that time. And I think from my perspective and from us understanding what's happening with some of our regional food supplies during this pandemic and what we can plan for in the future is it sure looks like in a number of areas, those farmers markets were able to keep up with the innovations related to online ordering and phone ordering and curbside pickup and all of those things, as many people were taking advantage of those services. And it looks like are planning to continue to use those services in 2022. I'm not sure we're quite ready to say that's post-pandemic, but at least in the future.
All right, we have a couple of other questions real quick. Can you clarify what the definition of an independent grocery store is, like Publix or?
Sure.
All over the country.
In the case of Publix, we classified that more as a supermarket, not necessarily as an independent, even though it's not in every state necessarily. The independent or smaller format grocery stores, we were categorizing as more smaller grocery stores. Sometimes those are more family owned, local within one area. Maybe they have 1 or 2 locations, but I think Publix, we would say, fits into our larger traditional supermarket category.
Okay, so there's one more question and it's on this, related to this slide. Maybe there's 2. Was there a distinction made between people who pre-pandemic did not go to farmers markets and those who previously went, but during the pandemic did not go?
We have that data, but we don't have it broken down that way yet in these slides. We will continue to break down that data. We did ask them about their use of these markets pre-pandemic. So that is data that we could isolate and pull out, but that is not, we haven't got to that level of analysis here yet.
Okay, and did we have online farmers market? And if we did, could we give some examples?
Like, I think that may be a better question for some of the case studies and focus groups. This was survey data. So essentially this slide in particular, we had categories of, did you use these different types of food purchasing during these time periods? And within that question, if you used a farmer's market, you would indicate what format you use that farmer's market in. So yes, there were people that were doing online ordering for home delivery. So I guess that might closest align with your question about an online farmer's market. It does look like our one of our guests or one of our project members, Gustavo, from California, said there is fieldoffamily.org, which is an option for an online farmers market. So essentially, we didn't do a lot of defining for people of these categories, though. We asked them how they were acquiring their food, and if they were doing that at a farmer's market, then were they doing it for online ordering or home delivery? I suspect there are many areas of the United States where farmers markets were not online, but the data certainly shows that people were using that as an option. Again, the majority of the people were still attending or still obtaining their food in person for farmers markets.
Okay, let's move on.
Okay, so again, we've been really interested in our project team related to the regional food supplies of this piece. So direct from farmers and or food makers, but not from farmers markets is how we defined this category. So it might be a farm stand or a CSA. And again, the same types of acquisition. So did they use this? And if they use this, how did they acquire that food? The majority of the people, again, here in this, were not using farm stands and CSAs, but we were seeing people use them and perhaps, again, use them more throughout the pandemic. So in-store purchases or going in person were still the highest number of those people who were using this outlet were going in person. But again, we were seeing people taking advantage of online ordering and phone ordering and curbside pickup options for these regional food markets. So again, I think that really speaks to the responsiveness of some of our regional food supply systems that they shifted pretty quickly to having a lot of these options available, or maybe they had some of these options at play before, but more people were contributing to those types of outlets during this time. All right, so we also ask about meal and or meal kit delivery services. Again, I feel like anecdotally, we heard from quite a few people who were saying, yes, we're cooking at home more and we're using some of these meal kit services. So the majority of people were not using meal and meal kit services. You can see in that category. Some people were purchasing these within stores, which I think is an option at some of the supermarkets and things like that were creating kits that they might not have had previously to the pandemic, or maybe weren't as utilized as much until the pandemic hit. But again, those who were using this had more varied options for how they were receiving those. some people were in store, but more people were doing online ordering for home delivery when they were choosing to do one of these meal kit services. And again, there were some bundling options and pickup options for those as well. All right, so large national restaurant chains. So one of you asked a question about, were we talking about restaurants? This was the question here that really asked them about their restaurants. So large national restaurant chains in this question here. So again, this is why we collect data, because personally, my family was not attending these large national restaurant chains during those early and mid-pandemic phases of that time 1 and that time 2. But quite a few people were still continuing in those time 1 and time 2 to attend in person. And in time 3, as we suspected, more people were returning to those activities. And in 2022, the largest number of people were predicting that they would go back to those normal behaviors. But we can see people were doing online ordering for in-store or curbside pickup. That was that second highest option there. And in time 2, we really saw that one increase. People were also doing some of the other phone ordering for curbside pickup and online ordering for home delivery, including some of the bundled options there. We also wanted to highlight today some of those local independent restaurant types, because this was another one that got quite a bit of play in the media related to people really supporting their local independent restaurants. And it sure looks like in this data, people were doing that, particularly if you compare the large national restaurant chains. More people were not using those than were using the local independent restaurants during the time. So it's nice when our data can support some of the things that have been highlighted. So people were going to local independent restaurants in time 1 and time 2. Again, they were still going in the store in many cases here, but in time 3, they were returning more and more. And in 2022, expected to really be back in full force, going to their local independent restaurants. Another place is we're talking about how our regional food supply systems manage some of these new activities. People were doing phone ordering for in-store and curbside pickup. They were doing online ordering for curbside pickup, and they were also doing online ordering for home delivery, as well as bundling. I think interestingly, if you look at the online ordering for bundled services in 2022, people were still thinking that they would want some of those options. So as we're thinking how our local independent and regional food supply chains can continue to plan for the future, it seems that at least a portion of Americans have decided that those options will be something they want to continue to do as we move into the future, which may put us in a better place for local and regional food systems in future pandemics or future disruptions. If they already continue to have those pieces in place, that can be an important part of planning for some of the future disasters. Of course, some of that will depend on whether the economics are there for their business to continue to do that throughout kind of blue sky periods or not. With that, I am going to turn it over to Hikaru Peterson, and she is going to talk about our consumer choice experiment that we embedded within this survey.
Thanks, Lori. Hello, everybody. So we went through in detail about what the lived experience of these survey participants are. And the reason why we included a choice experiment was to kind of get their preferences for how they like to shop for groceries and food items in a more controlled way, so we can isolate things and we can predict how all of us might react in a different situation. And so instead of mirroring the design to talk about how they changed, the purchases over the 3 time period that Lori went over, we came up with 3 basic public health risk situation that we've recently experienced, but it's really more stylized. So one is where life is normal with no major health risk. And then the second level of scenario is when there's extremely high risk, which means that there's average daily rate of more than 45 cases per 100,000 people over the past 2 weeks. And so the local health office is actually saying, choose delivery or curbside pickup instead of shopping in person. And then one lower level risk, which is fewer, daily rates of cases among people, and that the local health office is recommending you can lower your risk while grocery shopping by keeping your visits as short as possible. Consider using delivery or curbside pickup instead. And many of us probably could have become desensitized as vaccines became more widely available. But New York Times still publishes these COVID risks. And unfortunately, this is what our nation looks as of today. So we still have a lot of areas that have this extremely high risk. So the way the choice experiment was set up was the consumers were asked to choose which ways they would like to purchase their grocery stores. And so we kind of assumed like a fixed distance to the retail outlet, and that there will be a delivery fee available for a fixed rate. And the logistics that we considered were whether they would purchase things online, in store, online ordering for curbside pickup, or online ordering for at-home delivery. There were options for where they get their grocery stores, whether at the farmer's market, food co-op, or a regular supermarket. There was also a distinction about the food origin, whether it was local and regional foods were available versus foods from anywhere. And then we also kind of varied the value of groceries they were considering, but it was also going to be like a regular assortment of food groceries that they embed. So we can analyze the data that the survey respondents completed to generate what are essentially demand curves. And so demand curves are, and I don't know how I look in the mirror, but it's a left-hand side is higher, and then the right-hand side is low, and it's looking at the relationship between price and quantity. And what is plotted here are essentially those demand curves for these different grocery shopping experiences. The horizontal axis measures the percentage of population who are willing to pay a positive or negative amount relative to the base attribute. And then the vertical axis is measuring those dollar premium or discounts. And so there's a lot of information in here, but if you just focus on, say, the orange line and see where it intersects with the where the y-axis is 0, then it's showing us that little less than half of the people are willing to pay for delivery service under normal life. And then if you follow a darker blue, you can also see that more than half of the people were willing to pay a positive amount for local foods. So these are kind of information we can get from these estimated demand curves. So this is under normal life. There's no public health risk out there. One of the things that, I'm sorry, Cheryl, one of the things that we can note from this first set of graph is that the light blue and the orange, which are the logistics, seems to be more responsive to price changes, as in those curves are steeper than the outlet choices, whether they're going to go to farmers markets or food co-ops, which I think is an expected result. And so now we can look at how the demand for logistics changed under different public health risks. So again, I'm sorry, there's a lot of different lines here, but each of the whether it's a curbside pickup or delivery are plotted for different levels of risk. And one of the extreme examples here is that if you look at the curbside pickup service without public health concerns, so under the normal situation, you see that about 40% of the people are willing to pay for curbside pickup. But then if you look at the under the high risk situation, it almost doubles. And so about 80% of the people are willing to pay something for that curbside pickup. The impact is a little bit less for the delivery service itself, about 47, 48% under normal situation, and then increasing to about 65%. One of the things that you do see is that the demand curves for the delivery services, which are in the warmer shades, seems a little bit steeper than the demand curves for the curbside pickup. And so I think Lori was kind of alluding to this, that folks, who actually prefer the delivery service are fixed in their preferences, whereas the people who are reacting to the curbside pickup options are probably more responsive to the public health risk situation. Here's a similar graph for the outlets and the public health risk. You see that it's a lot less interesting than the ones for the logistics. It's much more elastic or responsive to the price changes, it seems like. One of the major differences here is that the shift in demand for farmers market is not linear. So with respect to increases in public health risks. So when it first when the health risk starts to increase, it actually initially declines. So people are actually avoiding going to farmers markets or preferring to go to supermarkets. But then as that public health risk heightens, then the demand for going to farmers market over supermarket is actually increasing. And then the last of the demand curves here, this is looking at the demand for local foods. And again, similar to the demand for farmers market, it is not linear. So initially in this case, as the public health risk is increasing, what is showing is that people's demand for local food increases. But then as the public health risks even is exacerbated, then the demand for local foods declines, which I think also makes sense that, people are starting to worry more about other things than whether the food is actually sourced locally or not. But I think this kind of corroborates what we witnessed in 2020 as folks were turning to foods that were sourced more closer to home, thinking that it was handled less often, it traveled less, and therefore it seems like it was more safe food for us to consume. And so just to wrap up, Lori and I's work on the consumer survey to date, you saw that, the food purchases by category remained relatively consistent for majority of Americans over the 3 time periods. But the way Americans acquired food definitely changed over the 3 time periods. And I think as we look into 2020, it would definitely be shifting even further. One of the things is that the demand for purchase logistics is drastically affected by public health concerns, and that's how we adapted. That's how the businesses had to adapt. And then the changes in demand for local outlets and local foods during the pandemic were variable with respect to levels of public health risks. And so as the rest of the nation had different COVID experiences and how it played out, you can imagine that these demand for local foods and local outlets were variable as well. So with that, I'll turn it over to activity updates.
Afternoon, everybody. I'm Krista Court. I'll give the update on activity 1, which was our COVID-19 impact survey. If you recall, or if you joined us for the first or second webinar, we had some additional, summary statistics and results that we shared, especially in webinar 2. So if you want additional information about that, I would refer you back to the second webinar, and now I'm just going to let you know that we have our data files fully cleaned and ready to analyze. So we have an academic publication, and several of us have done a few podcast media interviews on an overall summary of what we found in this particular effort. We have several extension fact sheets that are underway with particular statistics that we found, or looking at particular business segments, as well as conference presentations and additional academic publications. So I don't have additional information to share with you today, but we are going to start getting that out. So please watch the website and additional resources that we put there that you can use to see what we found in that particular survey.
Hi, this is Michelle Miller. I'm with the University of Wisconsin, and I'm going to give you a quick update on Activity 5. To understand how regional food systems contribute to resilience, we need to also understand what the national supply chain looks like. And so our team has been working with Megan Konar at University of Illinois and her modeling team to understand some of those things. This is very early preliminary results, but one of the things we've noticed is that there's some concentration, geographic concentration in supply chain importance around the country. These are the counties that are critical to the national meat supply chain. And you'll notice that there's a lot of counties around LA, and then a lot of counties around Chicago. All those counties in that area are in Illinois. And then we've got that one county in Michigan, and the one in Texas as well. So that gives us an idea of, where there's some, where there could be stuck places in the food supply chain. I saw in the chat from Ron Wilson about the issue around meat packing plants closing and empty meat cases. If you were dependent on purveyors in that Chicagoland area, or the LA area, or Michigan, or Texas, and they were having problems, then your stores definitely experienced problems. My understanding is that there is more work planning to be done to open more and to improve the way that meat supply chains function in the country, which would include adding more local butcher plants. Next slide, please. So here's another way of looking at it. We just looked at the California study region and the Minnesota-Wisconsin study region to understand the structure of the meat supply chain at the national level. And what was interesting was that the counties in California, Santa Barbara, San Luis Obispo, San Diego, Imperial, and Kern, are all approximately the same importance in the supply chain as all the counties in the Minnesota-Wisconsin study region. We didn't see that kind of extreme activity that we noticed in the previous slide, where San Bernardino, Riverside, Orange County, LA, and Ventura really stick out as critical to the national meat supply. So that's what we've got now. We've also been doing similar work on activity, on dairy. So we'll have more analysis soon. Thank you.
Okay, Laurie, did you want to take this, or you want me to? Either way is fine.
Oh, sure. I mean, I'm happy to. We have been extremely fortunate with all of our team and staff on this, but we just finished the website update for this project. And so many of our speakers referred to it. We went live last week, so we think we've worked through all of the pieces, but this is the new lookout. We do have media releases. We have 2 extension fact sheets there now. In the coming weeks, we hope to have more. With a project team our size, we want to make sure everyone reviews it and is comfortable before we post those those, but we have quite a few more planned. And as you registered for this webinar, we will alert you when we post new things. We have also done some podcast interviews and conference presentations and academic publications. And if you go to our ruleengagement.org/lessons from COVID-19 toolkit, you will be able to access all of those resources, as well as contact our project team to find out more information about this project.
And I just put the link to that in the chat. So please go look at it. We're excited to have a shiny new website to share with all of you. So just a quick reminder for what we have coming up for learning opportunities. This webinar has been the third of a series of 4. So we'll have another one in April. And if you are already registered for this, you'll get the reminder. But if you think there's anybody else who would be interested in this topic and this content, please share the link with them so that they can get registered and be up to date on all of the content that we're generating and preparing for all of you. So shortly after our next webinar in April, just a couple of weeks, we're going to have a Train the Trainer conference on May 5th. So please save the date. It will be online. It will be synchronous. So it will be live. It probably will be just a day or less than a day. So we'll have more clarity on the details of what that looks like in the coming months to share with you. It's a really quick project, and there'll be a lot to share by then. And so right after that, we're going to develop and launch an online course that'll be available towards the very end of the project period, so July, August of 2022. And this will be asynchronous, so you can take it at any time, but we'll have office hours with all of us if you want to ask us questions about what you're learning and seeing in the online course. So we are looking forward to developing that for you. And again, this screenshot here is the 2 previously archived webinars. They're on this toolkit page for the project. So you can watch them, you can download the PowerPoint slides, anything that you would like to have access to increase your understanding of what we are learning in this project. All right.
And another opportunity for all of you to participate in the project is an invitation to have conversations in focus groups. We are we're planning to have these focus groups in early 2022, and we're planning to facilitate it as opportunities for all of us to exchange ideas for improving resilience of our food system with other food supply chain business professionals. And so this sparkly, fancy new website, there is at the bottom of the toolkit website is a link that says sign up. And if you click on it, it asks you for the information, and we will follow up shortly. If you're interested in focus groups, then we would love to hear from you and participate in our conversation. You'll be very much future looking in a sense of how can we process the experience that we've had in the past almost 2 years, and how we can move forward to better our food system.
And I popped that link in the chat, so please feel free to go join that. We would love to have you. Okay. And this is our last slide before we have a few minutes for questions. And we just want to thank you for learning with us. We invite you to join us and plan for our next and last webinar on April 21st, 2022. And that link will take you directly to the Zoom registration page, but you can also find that on the website links we've already popped in the chat. So save the date for our Train the Trainer conference. And if you have questions, the primary investigator on the project is Hikaru Peterson, and her email is hhp@umn.edu. So she's the one to go to for all of your questions. And with that, we have some time for questions. Let's see, how much time do we have? We have about 8 minutes. So I will try to surf through. Laurie, can you see what the questions are as well? Let's see.
Can see, let me.
Alan is asking if there is a COVID-19 flu surge this winter, and what are our expectations as far as food purchases? I'm not sure our data leads to an answer to that question. Would you say that, Laurie?
Yeah, I mean, I think we are trying to understand what will happen in the future. We have not gotten to the piece where we're going to put all of these data points together yet. We're still analyzing pieces of those along the way. I think what we've seen related to time 1 and time 2 and time 3, as well as the consumer choice experiment, is that people likely would move more toward those online purchasing and curbside pickup options when they're acquiring their food. I saw Hikaru pop on. I don't know if you had something else to say, Hikaru.
And those options are more robust than they were when we started this. So I think the ability to shift quickly is something we're adapting to.
Right. I was just gonna chime in that I think it is very clear that people will turn to those logistics that will keep them safe, that would prevent us from interacting directly with other humans. That, you know, I think our food system has adapted or developed over this past 18 months. But I think it's also clear that from our analysis, that when we're talking about, you know, specifically like origin identified food and stuff, it will fluctuate on how bad the surge is going to be. And of course, one of the other things that I think plays a role is the effectiveness of vaccination as well.
Absolutely. I would also say that one thing that we're working on isolating in our fact sheets and some of our other data analysis that we aren't quite ready to release yet is differences by region. And I think we suspect that that access to some of the curbside and online platforms in particular might be different in different regions. So hopefully we'll have more to come.
So there was a question about whether the data is split by age, and I believe that is the case. Yes.
Well, we have not split it by age, but we collected age information from people. So we do, and we did sample related to age. So we have an adult population that is representative of the population in the United States related to age, but we have not isolated, you know, do 18 to 21-year-olds purchase their food differently than, you know, 45-year-olds, but we have that data and can break it down that way, but we have not done that yet.
That's what I thought. Thank you. Gloria asks, has reliance on just-in-time inventory systems placed additional stress on supply chains? And I don't know if we have investigated that. Does anybody have any ideas? I don't know if that was part of that first project.
I don't know that we directly collected data. Certainly on the consumer side, we did not collect data related to inventory. I don't know, Krista, if on the supply chain survey, if there was something related to just-in-time inventory, or if that might be something that comes up in the focus groups.
Can you repeat that question, Lori?
Sure. The question from Gloria is, has reliance on just-in-time inventory systems placed additional stress on supply chains?
Yeah, I don't know if it's placed additional stress on them, but it was certainly one of the things that we heard about, that it was one of the stressors during this event. We did ask about, we had a different project going on where we asked a lot about adaptations and risk management, more of an interview style with producers across the supply chain. And it did come up there. I don't know if we have the information to tell whether that's going to change or not. But it was at least a stressor during this pandemic event where it threw things up in the air a little bit more.
Yeah, there's a comment in the chat about school disruptions, and that's more recent than the data that we collected. So yeah, like another interesting piece of that supply chain challenge. So this is ongoing and continuing, and you know, hopefully somebody will capture all of this detail.
I think that's part of why we're having these. One of our project partners in Minnesota just sent a note to our group that is a question that they can bring up in particular in the focus groups, so that maybe we can have a better understanding on that.
I don't think we collected any data on food waste, but there was a question about whether or not we did.
We did not specifically ask about food waste in the consumer survey. I don't know if on the producer supply chain side, I don't think we ask related to waste in particular. There were many questions that we wanted to ask that we had to go through and decide what our main focus was and what we had space to include.
We did ask about the different priorities that people placed, and I don't remember if it was explicitly food waste or not, but waste or in terms of like a plastic waste, or like all the packaging and stuff, I think was one of the items that we asked them to tell us how they changed their priorities over the pandemic.
Okay. There's one more question in the chat, but I'm not sure that we can make a value statement on whether on how the things have been handled in the United States. I think history will probably be able to have a better statement on that, but we appreciate your question and contributing to the conversation. So with that, I think we're going to go ahead and wrap up today's webinar. We thank all of you for participating, and you can look forward to an email with links to the recording and a copy of the PowerPoint slides to download from the website. And look forward to hearing more from us in 2022. There will be lots more opportunities to learn and to grow in your expertise and your professional development on food, local and regional food systems, and our national food systems, and how we can better be prepared. So thank you for joining us, and we'll see you next time.